Sorry.
Thanks for coming, y'all. I'm Jennifer Burrell. I'm the founder of Works. I'm in the planning for your futures. And for those who are professionals trying to learn a little more, it's marketing. So I am here to introduce you to Grossinger, who happens to be a friend of mine. So you might have heard me about that. Sorry. The Senior Services Coordinator at the Good Shepherd Hospital, and they are still responsible for serving help us fight this. Susan worked with older adults in their family for 50 years.
It probably,
Several different capacities, including case management, program coordination, and training, senior services coordination, and Medicare counseling. She's been an advocate for Shepherd Hospital for over 22 years as a senior services coordinator. Her duties include providing resource information and assistance to adults and their families. Medicare navigation as a senior health insurance program, she counseled for the last 15 years and coordinated the matter of balance fall prevention program as a master trainer. That's really she also represents the hospital out in the community for educational programs and volunteering on organizations. Please welcome Sue Bessie.
thank you. Ah, thank you. Okay, thanks. I got my clicker. I have actually been at Good Shepherd 23 years now. I aged between the time they got the information and now, and a ship counselor for 19 years, meaning they started the initial enrollment for the prescription drug program and Medicare Advantage as of October of 2005. So I've been doing this a little while, and I really like to help people understand their Medicare, even if you've been on Medicare for a long time. Okay, it's important to know that there are choices. I don't think people know that. If there's anything, I hope they handed out a flyer. Yep, that's it. It talks about the two different choices. This is normally an hour and a half or more presentation. I only have about an hour. So if you learn anything, I want you to learn that once you do go to Medicare, you have choices on how you get your Medicare. So we're going to talk about that. I'm going to try to kind of go through things. It might seem a little quick. This is a lot of information, but I also want you to know there's help. You can get help if you need it, okay? The other thing I want you to know is if anyone knows what it's like to transition to Medicare, everybody starts telling you what to do, what choice to make. Do this, do that, and everybody has their own ideas. Guess what? That is their own idea. What's best for you may not be what's best for them. So all that cacophony between TV, your mail, email, Bertha down the street, Fred, your brother, all of that goes out of the head. You have to kind of start and think about, what do I want? Okay, so that's how we're going to start. That's me. I am at Good Shepherd Hospital. I am a certified senior health insurance program counselor, all right? SHIP's mission, we want to empower, we want to educate, we want to assist Medicare eligible individuals, their families. We do outreach, we do individual counseling and training. I want you or someone you love who you're helping to make informed healthcare decisions that optimizes your care and benefits. I want you to get your Medicare how you want it, not how somebody else tells you to do it. I think something's flashing. Is it one of the lights? There. That one. So today, our agenda, I'll try to go through everything. What is Medicare? There are 4 parts to Medicare. Why? Because they're all funded differently, but that's another story. Medicare supplements, Medicare Part D, Medicare Part C, which is Medicare Advantage, Medicare comparison summary, enrollment periods and process, and available resources. I want you to know that on the Advocate Health website, we do have a section on Medicare, lots of information, okay? So you can continue to get that. We have a resource guide that's also on our website. 90% of this information is in that resource guide. So, welcome to Medicare. What? Okay, we're standing there going, what do I do? All right. One of my goals when I'm doing this presentation for the hour and a half, because it's so much information, is not to have people either their head explode while they're in the room or leaving for the day. So I'm going to try not to give you too much information so you don't feel overwhelmed, but there is ways to get more to help you. Medicare is a federal program. If anybody talks to you about Medicaid, that's a state program for low-income people to help get their health insurance. So Medicare is a federal program that provides you with your health insurance. You have to be 65 or older. If you're under 65, you have to be deemed disabled by the Social Security Administration, and then after 24 months, you become eligible for Medicare. If you encounter or get diagnosed end-stage renal disease or ALS, you automatically get enrolled in Medicare. You have to be a U.S. citizen or a permanent legal resident in the U.S. for a minimum of 5 years. And Medicare is managed by the Centers for Medicare and Medicaid Services, which we call CMS. Just one note, it's your work history or your spouse's. It affects your Medicare premium for Part B or A, if you do have a premium for A, but not if you're eligible. It has to do with if you have a premium or not. If you have a divorced spouse, you can apply for Medicare benefits on their work record. They'll never know, don't worry. But you can apply for Medicare and Social Security on their work record. So when somebody comes into my office, my first question is, what's going on with you? I want to know what path are they on, okay? Are you retiring at 65, so you're going to lose your insurance and you need to go to Medicare? Do you plan on working past 65? If you are, do you still have access to an employer insurance? And what does that mean? You might want to look at whether you want to stay or go to Medicare. And are you covered under someone else's health insurance that is working? So I really need to know where you are at so I know what your path is. What's the best direction to start working with you? The 4 parts of Medicare, okay? Part A, hospital, inpatient hospitalization at a skilled nursing facility or a hospital. Other parts of services like home health or hospice, it does have some things covered by Part A. It's usually the skilled care part. Part B, the other part of the federal Medicare program, is pretty much everything else, okay? Doctors, outpatient services, emergency room, ambulance, durable medical equipment, any day surgery, anything that's outpatient or not an inpatient care is Part B. Those 2 things together, A and B, is what makes up your medical insurance. It's just like when you worked, except you had one card. A and B is your medical health insurance that's provided to you by the federal government. In 2005-06, they added the Part D program, which is the prescription drug part plan, or Part C, which is Medicare Advantage plans. And what those are, both D and C are offered by private insurance companies. Part C, or Medicare Advantage, is the other way that you might want to get your A, hospital, your B, medical, and your D, your drug coverage, bundled all in one plan. So you have 2 different options to get those benefits, A, B, and your drug coverage. It's just a different way of getting it, and we'll talk about that. This, if you learn anything, this is what I wanted you to know, and I did give you a printout. This shows you the options, and I'm going to probably spend a lot of my time on this. So, the traditional or original way to get your Medicare, you have Medicare A and B. Medicare's paying your claims. It's your primary insurance. Part A has a deductible. Part B, it's 80/20 after the Part B deductible. And then people get a Medigap or a supplement to pick up some of those costs after Medicare pays, because Medicare doesn't pay 100%. There are some co-pays, co-insurance deductibles that are left. So people will pick a Medigap plan depending on how much coverage they want and what they want to pay in a premium, so that it goes along with Medicare A and B. And then you get a separate prescription drug plan. So you're kind of, how you know today, if you're working, you have one card. It's your medical and your drug coverage. This is broken up the traditional way into 3 different parts. A and B, your Medicare card, primary, supplemental insurance. Supplements are standardized by the government. There are 8 of them as of now, but they are not a part of Medicare. They're provided to you by private insurance companies, but they only exist to go with Medicare A and B. So they're not, you know, some people have said to me, well, if my Medicare doesn't pay for it, will my supplement pick it up? No, because your supplement is strictly there to pick up the co-insurance or co-pays or deductibles that A and B leave. It doesn't exist by itself. So you buy a supplemental plan that's standardized, and I'll show you them to you, but it is not part of Medicare. Okay, so this is the traditional way to get your A and B and drug coverage. It's kind of separated. Medicare primary. You had a question.
Isn't the supplement is supplementary a medical undertaking?
That's after a certain period of time. You have 2 thresholds of time that if you get your supplement within 6 months of getting your Part B, they can't ask you any medical questions. After that 6 months, you may be usually subject to medical underwriting, okay? When you go to Medicare Advantage for the first time, you have a 12-month trial period where you can switch back from a Medicare Advantage plan back to traditional Medicare and get a supplement with no medical underwriting. But after that 12-month trial period, you can be subject to underwriting. They can charge you a little more money, or they can completely refuse you. We are lucky here in Illinois. We're one of 6 states that has a company that is guaranteed issue, if you're over 65, to get a supplement with no medical underwriting. It's Blue Cross. They have a part that's called a secure plan that they will underwrite you, and then their regular guaranteed issue where they won't. So I've had people who were sick in the hospital, wanted to go from Medicare Advantage back to traditional Medicare, and they just signed up for a Blue Cross with no medical questions asked, even though they had just been diagnosed and were actively being treated for cancer. They were in the hospital, yeah. Well, yeah, they cover you when you're in the hospital. That's Part A. The supplement picks up the Part A deductible. It is not an insurance by itself. It operates secondary to your Medicare. Okay?
But what I was asking is Medicare supplement, then suppose somebody is in the hospital on the treatment, does not get qualified for this.
If they didn't have a supplement and they were actively being treated, they would probably not get a supplement. Yes. Yeah? So, the other way, this is this little or, is Medicare Advantage. What this is you're telling Medicare, I don't want to get my Medicare A and B benefits and drug coverage through you and a separate prescription drug plan. I want to purchase this Part C Medicare Advantage that provides me with Part A, Part B, and D, but within the structure of an HMO or PPO. We used to have more private fee-for-services. I don't think we have very many of those anymore. So you get, instead of Medicare paying your bills, you've picked an insurance plan that's a Medicare health plan in the form or structure of an HMO or PPO. But you're getting your A and B and drug benefits through that plan. That's how you've decided to get it. So what happens with this is Medicare's not paying your bills anymore. That insurance plan is. But about 60%, if not more, don't have a premium for the Medicare Advantage. How do you get health insurance without a premium? Now, you still have to have A and B, so you will have a Part B premium, but you may not have a premium for that Medicare Advantage plan. I think somebody's paying somebody something, don't you? Medicare has to pay the insurance companies a set amount per month for every Medicare beneficiary they insure. Your employer, if you work, does the same thing. No one's going to give you health insurance if somebody isn't paying them. It can cost a lot of money, up to $20,000 a year per employee. Your $100 that you pay in premium is it's not the full amount. So Medicare does the same thing. They're paying that insurance company to insure you on that HMO or PPO because you told Medicare, this is how I want to get my Medicare benefits. Okay? So they're in the structure of an HMO or a PPO. Okay? And it is different than this, how this works. And I'm going to show this to you hopefully quickly. So let's say our neighbor down the street, Bertha, has original Medicare. Okay? So her Part A costs, the first 60 days in a benefit period, and I'll explain what that is, she'd have a deductible of $1,632. So if she's in the hospital 1 day or 5 days, we bundle all the bills, all the services except the doctors into one charge, and then there's a deductible. A benefit period is you go into the hospital for 5 days. They diagnose you, you go home, and so you have total of 150 days in a benefit period for hospital. If you go out of the hospital and you stay out of the hospital or receiving any Part A services for more than 60 days, you're in a new benefit period with a new set of days. But you'll have a new deductible if you go back into the hospital as an inpatient. So it's not a calendar year, it's a benefit period, and that's just for Part A services. My dad was in and out of the hospital every 3 weeks for 5 months when he was alive. He used one deductible for that 5 months, okay? He had an epiphany. He was out of the hospital for 10 months. When he went back to the hospital, new benefit period, new set of 150 days. He had used 55 hospital days of his 150. But when he stayed out of the hospital for more than 60 days, he got a new set of 150 days, but a new deductible. Skilled nursing, a little different. If you go to a nursing facility from a hospital stay for rehab, the first 20 days, there's no cost after a 3-day hospital stay at least. Then if 21 to 100 is a $204 copay per day. Some of these changes, the deductible, the copays, those change from year to year. And then home health, there's no copay, but you will pay 20% for durable medical equipment, like a wheelchair. Let me get through this real quick because otherwise I won't have time, and then I can answer some questions. Thank you. Okay, Part B, annual. This year, the base premium for Part B is $174.70 for new enrollees. Social Security tells you what your Part B premium is. You may have to pay a higher amount if your income is higher, your adjusted gross income. Part B pays 80%. Oops, sorry. You're left with a 20% coinsurance, all right? A lot of preventative services are zero, and then mental health services used to be 50-50, but now it's 80-20, so you're 20%. Part B, you have to have Part A and B if you want a Medigap policy, because Part B pays for doctors, all outpatient services. You can't get a supplement if you don't have Part B. If you want to join a Medicare Advantage plan, you have to have Part B. because you have to have A and B, because that's what they're going to provide you with, is your A and B services. If your employer, you're still working, has less than 20 employees, Medicare has to be primary. So that's important to know if you work for a small company, whether you want to stay on that insurance. But if there's less than 20 employees, Medicare has to be primary. For active employment, if you are actively working and have an employer group health plan with more than 20 employees, there will not be a penalty if you enroll in Part B within 8 months of losing your coverage. I don't know why anyone would want to wait 8 months. Sometimes people do because they get a severance, and that gets tricky. Got to make sure you don't blow yourself out of that initial enrollment to B. You may want to delay Part B if you continue with your employer's creditable coverage past the age of 65. You won't get a penalty because your employer will prove for you through a form that Social Security has that you were working and you had coverage, and that's why you didn't get Part B when you turned 65. If you don't have coverage from active employment and you don't get Part B, your premiums will be higher because you'll get a penalty, and you may have to pay for health care out of pocket because you can't enroll until a general election period. This is Irma. One time I was doing a presentation, and the current active hurricane was named Irma. But Irma is income-related monthly adjustment amount. And what this means is they go back 2 years. So this year in 2024, if you sign up for Part B, they're going to look at your adjusted gross income from 2022. And they're going to calculate, do you pay the $174.70? Because as a single person, it's less than $103,000, or a joint return, it's less than $206. Or do you have higher income? And so you have to pay a Part B premium of $244, $349, etc., as your adjusted gross income goes up. And then there's an additional amount on top of your Part D if you have a premium that you would have to pay also. The thresholds are different between individuals and married, finally, jointly, and then they go up, the thresholds go up every year. So it's 103 this year, it goes up 6,000 for single people. Next year it'll be 109 probably, and then 206, it'll go up 6,000 for each person, so it might go to 218 for next year, that threshold. And everybody says, wait a minute, I'm retiring. I'm not making the money I made 2 years ago. Well, that's why you have the ability to appeal, okay? You would fill out this SSA 44, and you would say to them, in 2020, say you retire in January of 2025. In 2025, my adjusted gross income will not be what it was in 2023. So you fill out this form, you tell them you have a life-changing event, which is work reduction, work stoppage, divorce, death. There are a few things, and you fill out that form and bring it to your Social Security office. What they want us to tell you is if you make a mistake and you don't calculate what you think your adjusted gross income will be for the year of that life-changing event, when they do find out 2 years later, you're going to have to pay the money back. And basically what you're paying back is maybe you should have paid $244 and you only paid $174. So they're going to make you pay back that $70, whatever that was, difference for every month. I have to tell you that. So once you get A and B and you've decided to have Original Medicare be your primary, that's how you want to get your Medicare, you want to look at Medicare supplements. Those are also called Medigap plans. They're the same thing, just different words. They're sold by private insurance companies because they're not part of Medicare. Medigap plans function as a secondary to Medicare. You get guaranteed issue or no underwriting for the first 6 months after your Part B starts. Supplements require a prospective policyholder, if you are beyond that 6 months from getting Part B, or you're in your beyond your 12-month trial for Medicare Advantage, you may have to answer health-related questions. That's called medical underwriting. All policies with the same letter, a G, an N, a D, whatever that letter is, the benefits of that policy is the same. A G is a G is a G is a G. An N is an N is an N is an N, okay? Premiums go up as you age, all right? That's one of the negatives of going with original Medicare and a supplement is the older you get, they can't drop you, so they'll, well, this person's going to charge us more money. They're 75 now. But every year they may tweak that premium. Plans cannot be canceled, nor can they charge a higher premium due to health conditions. So while you're on that plan, they can't judge you based on your claims, okay? But that's why they raise your rates every year, because they know the older you get, the higher risk you're going to be to them. These are the supplements or Medigap plans. The C and the F, if you can see these are no longer available to people born after January 1st of 1955. The reason, these were the two plans that did pick up the Part B deductible. I heard Congress decided in their wisdom, and not being sarcastic, that they thought if seniors had to pay the Part B deductible, which this year is $240 for the year, they won't go to the doctor so much. And so they'll save them money. Well, I work at a hospital. If you don't go to the doctor, you get sicker. And if you get sicker, you use more services. And if you use more services, you cost more money. So, and no one asked me. I wish they would have. I would have told them correctly. So anybody born after January 1st of 1955, the G is the most common, it's the most popular. The only out-of-pocket you pay is the Part B deductible. The other deductibles or co-insurances are covered. The N is pretty popular too. That has up to a $20 copay. And after the deductible, and then the supplement will pick up the 20%. There's the Part B deductible as well, and then there's something called the Part B excess charge. What happens is if a doctor doesn't accept assignment or the contracted rate of that claim, then they are allowed to charge 15% over the Medicare contracted rate. So if you're in a plan that doesn't pick up the excess charge, you'd have to pay that 15%. 95% of doctors and facilities, maybe higher, accept Medicare assignment. I do know a couple of people down, orthopedic surgeons, I don't know them, but I've heard down at Rush, don't accept Medicare at all. I had a sister call me once, she wanted to sue the orthopedic surgeon who charged her brother, I think it was like $30,000 a hip, because he didn't take Medicare, and she wanted to get his money back. I said, did he know that the surgeon did not accept Medicare? And she said, yes. And I said, there's nothing you can do. And I also said, if a surgeon is going to bill me $30,000 a hip, he'd better make me an Olympic athlete, because otherwise I don't think it's worth it. So most doctors accept assignment, but you should always check that they take Medicare and they accept assignment. I think this year, I think it was in 2024, if not 2023, they added an Illinois Medigap plan birthday rule. So if you have a current Medigap plan and you're between 65 and 75, you can switch to an equal valued plan, Medigap plan, or lesser from the same company on your birthday up to 45 days without medical underwriting. Now, I wish they would have done this a little different. I wish it could have been any company and also not only equal or lesser, but we got to take what they give us, okay? So this is a little bit more opportunity to switch, possibly without medical underwriting every year. Part D. This one is for a good night's sleep, and this one for the headaches I get trying to understand the new Medicare drug plan. So I like to say that ship counselors were a little Motrin, Advil, and Aleve. We like to take away your headache for you. Part D is the prescription drug program. Before January 1st of 2006, there was no drug coverage. My mother passed away in 2002. She was spending $800 a month for her prescriptions. So before that, you were on your own. So we are lucky that we have some type of prescription coverage for Medicare beneficiaries. It's offered by Medicare-approved private insurance companies. They have to follow Medicare rules and the structure of their drug coverage. You have to have at least Part A, if not A and B. You can get your drug coverage two ways. One in a standalone prescription drug plan, or most Medicare Advantage plans, I think it's about 89 or 90%, do include prescription drug coverage in that Medicare Advantage plan. So instead of Medicare Advantage, we call it MAPD, Medicare Advantage Prescription Drug. You choose the plan to meet your needs, all right? Convenience, lowest cost, the pharmacy. So when someone comes in to see me to pick their drug coverage, what drugs do you take? What pharmacy do you want to go to? That's it. And we try to pick every year the best plan financially for them that's going to cover their drugs. The drug plans and the Medicare Advantage plans sign new contracts with Medicare every September. What do? They tweak for the next calendar year. So you really need to make sure if you're on prescription coverage or in a Medicare Advantage plan that you review this every year to make sure it is still working for you based on what you need. This year in 2024, the premiums range from $0 to $108.60. The higher premium plans are not necessarily the best. You can have the 0 premium plan be great for you. So it just depends. And also, the plans have what's called preferred pharmacy networks. So you make sure the pharmacy you want to use or one you're willing to go to is in the plan and provides you with the best coverage. Do you have creditable coverage? So if you get drug coverage through an employer or the VA, it's creditable. There are changes for next year. I'm not going to go through that necessarily, but the Part D plans will be possibly sometimes considered better than employer insurance, but we've been told, and I'm not positive, that those employers that already have said that your drug coverage is creditable will be grandfathered in, even though the Part D program may be better. So it's kind of, we're learning as we go here. We'll know more. Is your coverage going to end that you have when you retire? How much, I have people that stay on employer insurance right now because it's better. That is probably going to change next year. They've done some good things, hopefully. So some people continue to work and use because their family member, their loved one, their spouse is on astronomical drugs, and they keep working because the drug coverage with the employer is better. But hopefully that's going to change. And what are the premiums? So without creditable coverage, and you go beyond 2 months from when your coverage ended, you have blown yourself out of a special enrollment period, and you will start accruing a penalty, which is 1% of the average monthly prescription drug premium times the number of months you were late. That's the amount of your penalty, and that's tacked on to your premium for the rest of your life. So yes, when we first started doing Part D in 2006, we were told to tell people it is voluntary. However, if you don't get it and you don't have drug coverage, you get penalized. So depends on your definition of voluntary. This year, the Part D national base premium was $34.70. So if you were without coverage for 10 months, you would take 0.10 times 3470, and that would give you your penalty. How the drug plans set, kind of, I like to say, how they set their price is they tier the drugs. Tier 1 is a preferred generic, Tier 2 is a non-preferred generic, Tier 3 is a preferred brand, Tier 4 is a non-preferred brand, and Tier 5 is specialty. However, we see lots of times generics are considered Tier 4s. A lot of times, like, don't go to the dermatologist. No, I go every 6 months. So go to the dermatologist. But the creams they want to give us are really, they're very highly tiered. So just, know that even though something is a generic, it may be tiered higher and maybe cost you a little bit more money. We are going to save money with the Inflation Reduction Act. It lowered a 1-month supply of insulin to $35, covered some vaccines under Part D that were not covered before, like the shingles vaccine. If you have full extra help, if you get extra help, there used to be partial and full, now it's all full. And they got rid of the catastrophic level, which would have been 5% coinsurance for your drugs. Now it's 0, okay? Next year, in 2025, they are getting rid of something called the donut hole, which has really been hard for people because you go from, there's 4 stages of Part D. You have a deductible period, an initial coverage period, where you pay a low copay or a copay, and then when you hit the donut hole, the copays go to 25% of the full price of the drug. So people with a drug that they didn't realize was actually $500 retail, because they were only paying a $46 copay, when they hit the donut hole, then they're paying 25% of that $500. That stage, the donut hole, is going away next year. And they're adding a maximum out-of-pocket of $2,000. We don't know how the prescription drug companies are going to respond. It's a wait and see. We're hoping that they play nicely in the sandbox, but we'll see how it's going to look. We'll know during the annual enrollment period of October 15th to December 7th, or if you're transitioning to Medicare after October 1st, we will see the new plans for 2025 after October 1st. So hang on. People have low costs or low income. They can get extra help, which means the government will help pay your premium for your Part D plan and lower your drug costs even more. Not all Part D plans participate. In 2023, we had 7 drug plans that coordinated with extra help. This year, we only had 1. So every year is different. Medicare Part C. This is Medicare Advantage. It is, we were looking with Bertha on the left-hand side, original Medicare, a supplement, and a separate Part D plan. This is the right-hand side that we saw on that graph. Medicare Advantage, where you've told Medicare, you're not going to pay my bills. I'm going to purchase this HMO or PPO that's a Medicare health plan, and I want to get my A and B and drug benefits this way. Medicare plans are called Part C, Medicare Advantage, or Medicare Prescription Drug, MAPD. They are a bundled private plan, which is an alternative to traditional original Medicare. Medicare pays a fixed amount. Remember I said that? Medicare has to pay the insurance companies to insure us old people. Otherwise, they wouldn't do it. So there's a fixed amount that they pay for your care each month to that private insurer. And the insurer has to follow rules set by Medicare. You have to have A and B for you to get a Medicare Advantage plan, and you have to continue to pay your Part B premium. Choices vary depending on county and your zip code. So in Lake County, there's 43 plans. Cook County, I think it's 58. I think Kane County is 56 or 58, and McHenry is 51. Sorry. So every county is different and has similar but maybe different plans. Even if you say you move 2 blocks away, but it's a new county, you better re-enroll. Even though you want your same plan, you got to re-enroll in that plan with a new address. Don't let any insurance company tell you just to give the new address. I've been through this rodeo way too many times, where they thought they just gave their new address to the Medicare Advantage plan, and about 2 months later, they got a letter saying, you moved out of our service area, we're going to terminate you. Re-enroll. Medicare Advantage trends, 2023, 51% of Medicare beneficiaries are now in Medicare Advantage. It started in 2007 with 19%. Has become much more popular. I really feel the reason they became more popular, even though people, if you don't use a lot of health care, it really can save you a lot of money. I think that baby boomers, I am a baby boomer, we've been on managed care, HMOs and PPOs our whole life. That's how we know insurance works. So Medicare Advantage can make sense to us, more so than like my father, who was on original Medicare and at 88 paid $300 for a Plan F. So he paid his Part B premium and $300 for his Plan F. $300 was back in 2010. Now it's over $400 for probably or so someone his age. So you're paying more in advance with original Medicare to not pay later. With Medicare Advantage, you're actually paying less in advance, but you pay as you go, as you render healthcare services with copays and coinsurance up to a maximum out of pocket. So Medicare Advantage plans include all the benefits and protections of Medicare A and B. Most, I think it's like 89%, cover prescription drugs. Each plan has different benefits, different ways, their copays are different, their coinsurance is different, their drug formularies are different, and the in-network pharmacies. So where Medicare Part B pays 80% for, say, the emergency room, and you have 20% coinsurance and your supplement picks that up, with Medicare Advantage, the emergency room could have a $100 copay or a $200 copay. So it's really structured how HMOs and PPOs are structured, where you have a coinsurance. You have to use usually network doctors or hospitals. HMOs, you're much more restricted to that network. You can't go out of network unless it's an HMO POS, which is a point of service. There's a little bit more out of network costs, opportunity. PPO, larger network. You can go in or out of network if the provider will bill for you. Out of network can have a higher coinsurance. That's your responsibility. But the big thing here is you pay as you go, as you render health care. With original Medicare and a supplement, you're paying for that supplement whether you use it or not. It's for what if, okay? So it's two different mindsets when you're looking at making that decision. Do I want original Medicare and a supplement? Because I have people, they don't want any risk. I want to hand somebody those 2 cards. I want to say here, take my test. I don't have to worry about a thing. You have other people, I don't want to pay for that supplement if I'm not using it or it's going to go up as I age. So they would rather go with a Medicare Advantage plan. This is how personalized this is. It's up to you. It's up to how and where you want to get your health care and you want to spend your health care dollars, okay? And the Medicare coverage and out-of-pocket costs are different from plan to plan. The Medicare Advantage plan premiums range from $0 to $202 a month. That $202 premium, I think, is for a plan that really has no out-of-pocket costs. So it kind of, again, where are you spending your money and how? Medicare Advantage plans are guaranteed issue. You don't have to go through underwriting ever. Medicare Advantage, they used to underwrite people or not accept end-stage renal disease. They don't do that anymore. Medicare Advantage plan premiums do not increase by age, but they can change from year to year. Remember I said they sign new contracts with Medicare, so they can make changes. I always tell people to look at star ratings. Medicare does surveys to make sure that people are being treated right, whether it's customer service or quality of care. And so when you look on the Medicare website and look at the different plans that you might be interested in, they will have a star rating. Somebody's under 3 stars, I would be concerned about signing up with them. Because if they don't get to 3 stars within a few years, they can be rejected from the Medicare program. All Medicare Advantage plans have annual out-of-pockets. So when someone comes to see me, I'll say, and they want Medicare Advantage, what drugs do you take? Do you want an HMO or a PPO, or does that matter? What maximum out-of-pocket can you afford if you had a bad year? I will be honest with you. I knew someone, non-Hodgkin's lymphoma, 58 years old. 2 months, they met their $5,000 maximum out-of-pocket, and they were in treatment for 4. So you have to know that maybe one day, if you have a bad year, you have to be able to afford that maximum out-of-pocket, for your insurance, okay? Employer insurance operates the same way. I'm on my husband's PPO. We have a $6,000 maximum. I had my knee replaced last year. I paid about $4,000. I didn't need it. But you have to be able to do that. So I really want people to think when they're picking a plan, what maximum out-of-pocket is okay, okay? And then we look at provider network. Are your providers in the network of, we might pick 2 or 3 plans and see which is the best based on provider network. Prescription drug costs are not considered in this annual maximum. It has its own starting next year. They have extra benefits, woohoo, little fitness. You know, I had someone come into my office, she didn't care about anything, she just wanted ARP United Healthcare because she could get a lifetime. Go to Lifetime in Lake Zurich. Okay, she didn't care about understanding any of it. She just wanted to be able to go to Lifetime. Dental, little eye exams, hearing aids hearing aids, I don't know if it's a horn in your ear or no, I'm kidding, a real hearing aid. Over-the-counter benefits, little transportation. They're adding give back dollars, wellness dollars, flex allowance. So they're really starting to add some things in there if that's what's important to you. So we're going to compare. You pay a Part B premium for both. Original Medicare covers Part A and B benefits. Medicare does that. You may have an additional Medicare Advantage premium depending on which one you purchase. You can choose and pay a monthly premium for an individual Part D plan with Original Medicare. With Part C or Medicare Advantage, the plan covers your A, B, and then also includes additional benefits and can include Part D. I do recommend for people, I don't ever tell anyone what to do, but get the drug coverage. Don't tell me that you don't take any drugs and that you don't need it. I've had people not take prescription coverage at 65, and at 66, they had $600 a month worth of medications. And they had to wait till the next year to apply to get Part D. I was able to sign the person up for a manufacturer program. His income was a little bit lower. But don't ever go, you don't know, okay? Today you don't take anything, tomorrow you have to take a cholesterol, heart, blood pressure, et cetera, et cetera. You get AFib. Those drugs are expensive. Get drug coverage. It's not that much. Okay, I won't tell you what to do, anything else. Medicare provides the primary A and B coverage. The plan is what offer the insurance companies are the primary payer of your services. You have choices of doctors and hospitals in the whole United States. With Original Medicare, there's no networks if they accept Medicare or accept new Medicare patients. Most of the plans have networks of doctors and other providers you can and cannot go see. Generally, you or your Medigap plan pays those deductibles and coinsurance with Original Medicare. The reason people get a Medigap or supplement with Original Medicare, there's no maximum out of pocket. 20% of chemo per treatment can be a couple $1,000s. And if you're in treatment for 6 months, every 3 weeks, tens of thousands. You get a supplement, it picks up the 20%. You pay the premium of that supplement, you don't have the medical bills after the Part B deductible. So think about that before you make that decision. But generally you or the Medigap policy pays those deductibles and coinsurance depending on the plan you pick. With Medicare Advantage, you pay copays or coinsurance as services are rendered. You pay as you go with low to no monthly plan premium, most of them. Enrollment process, anybody becoming eligible for Medicare? Is everybody in Medicare? Do I need to explain the enrollment period to you? You can sign up for your Medicare benefit at age 65 and delay your Social Security. Our retirement age has separated a while ago from our eligibility age for Medicare. So whether you get Social Security really has nothing to do with whether you go to Medicare. Whether you want to continue working or go to Medicare, that is what your health insurance. Social Security is a different story. You can delay Part B and your drug coverage if you're currently employed with credible health insurance. I have a lot of people that come to see me when they're approaching, even though they want to work, what's better? And so we'll compare your employer insurance versus going to Medicare or Medicare Advantage. If you have an HSA with a high deductible plan, a health savings account, where you're making contributions to this HSA, they're pre-tax dollars. Consider talking to a tax advisor. You should not get Medicare if you want to continue contributing to an HSA. By law, a high deductible plan, you cannot have other additional insurance. So if you contribute to an HSA and have Medicare, say Part A, your contribution goes from pre-tax to taxable. So just be very careful about that. And if, say, you decide to continue working and not get Part A or B and continue contributing to your HSA, please know that if you're outside of your Medicare enrollment period, if you want to get Social Security, they automatically start your Part A. And they backdate 6 months or to your birthday month at 65, whichever came first. So you want to continue contributing to an HSA after Medicare eligibility, you need to talk to someone to make sure you're doing things right. Some people stop contributing and they just use the high deductible in their HSA until they retire. They stop contributing as the day that their Medicare becomes eligible. Some people change to a regular, PPO or whatever with their company, and they stop contributing and they just use up the HSA. Other people don't get Medicare at all, even though they're still working, and they wait until they retire. And then again, they would have to stop contributing 6 months before they get their Social Security or their Part A. So enrollment, you're automatically enrolled in Medicare if you're already on Social Security, okay? If you're under 65 and disabled, you're automatically enrolled at 25 months from when you got your disability eligibility. If you are automatically enrolled in Social Security, in Medicare, because you're on Social Security, but you're on a employer group health plan and you don't want to get B, if you automatically get your card, turn it over and follow the instructions to delay your Part B until you're ready to retire, okay? Or your spouse is ready to retire. You do not have to be retired to get Medicare. If you're not collecting Social Security and you're still working and have employer insurance or you're on the marketplace, you have to enroll yourself. Megan next door from Social Security, I'm sure, is talking about that because Social Security is your window to Medicare. You have to apply for Medicare A and B through Social Security because it's based on your quarter hours and whether you're eligible to sign up for Medicare. How many quarter hours? It's usually 40 quarter hours or 10 consecutive years. Talk to Social Security. When you turn 65, your initial enrollment period is you can enroll 3 months before your birthday month. It'll automatically start your birthday month. If you enroll the first day in your birthday month, it will start the next month, et cetera, et cetera. So it's like a 7-month period. Once you're outside of this 7-month period, you better be on your employer group health plan or your spouse's. Otherwise, that penalty after 12 months for Part B and D, 2 months, starts ticking. There's special enrollment periods. If you have employer credible group coverage, you get a special enrollment period to enroll in Medicare when your employer insurance is going to end. And your employer fills out this, it's called a CMS L564, which is an employer information form. Your employer fills that out and says, hey, Becky was employed from this date, she's still employed, she's had coverage from this date, and she's still covered. And you turn that in with your Part A and B application. Okay? If you may enroll in Part A or B anytime while you're still covered under your employer health plan or within 8 months of loss of coverage or current employment, whichever happens first. For Part C and D, you have to enroll within 2 months from when your coverage ended. Retiree benefits and COBRA are not active employment coverage. So some people get a severance and they have to be very careful. A lot of insurance companies now, even though you have 8 months to enroll in B, they may come back to you and say, you have to have B. We're not going to pay primary. 2 minutes, thank you. Okay. This is the forms that you need if you're already on A. A CMS 40B is your Part B application, and this request for employment information is what your employer fills out to prove you had creditable coverage. There's a general enrollment period, January through March. If you missed your initial enrollment period and you're not eligible for a special enrollment period. Every year between October 15th and December 7th, I'm nuts. It's my tax season. It's the annual enrollment period for people already on Medicare to review their drug coverage or review their Medicare Advantage plan. There's an open enrollment between January and March for people on Medicare Advantage. They can switch again to another Medicare Advantage plan if they want to. And then you'll get an annual notice of change when you're on a Medicare Part D or Medicare Advantage plan comes in September, and they will let you know what your changes are going to look like for the next calendar year. In conclusion, I got 1 minute. Woo-hoo-hoo. Medicare is a health insurance program. It doesn't cover all your health care costs. If you have choices in how you get that coverage, do you want to pay in advance for a supplemental premium so you don't pay later, or would you rather pay as you go with a Medicare Advantage plan? There are programs for people with limited income and resources. The decisions you make affect the coverage you get. Certain decisions are time sensitive. You can get help if you need it. There are SHIP program sites all over the state of Illinois, all over the country. And scheduled, if you're on Medicare, you're welcome to Medicare preventative visit. References, you can, if you want, you can go to SHIP. It's illinoisaging.illinois.gov SHIP, and you can see by county where the SHIP sites are. And then again, this is me and Sheila, my coworker. We're both ship counselors. Our office phone number, all right? But there are ship counselors all over. She's not here. I know there was someone from Hanover Park Senior Center. She's a ship counselor. Arlington Heights Senior Center. They're all over. No. You can get help. The help is there. And that is it. Does anybody have any questions? Yes, sir.
In Medicare cap, the other programs, the state Medicare, they are supposed to cover what Medicare is doing, but 90% of the time they don't.
Well,
They
that-
almost go to the denial and denial.
It depends. Medicare Advantage plans will have prior authorization on medical procedures, and they do deny. I think I've seen studies said that with 80%, 85%, if you at least try to appeal, it will get approved. But my employer insurance has prior authorization on things. That's what insurance companies do. So you have to be aware of that.
Especially because we are in Medicare and the biologics and everything.
Yeah,
They always
that's-
say it is experimental, whereas Medicare
Yes,
has approved.
right away.
Two different,
I had a doctor tell me that a spine procedure that he's been doing for years, he was fighting with a Medicare Advantage plan because they told him it was experimental. And he's like, what?
Yeah.
So he did get it approved. But it takes appealing and forcing them not to, making them look at it and realizing that, yes, we will approve it. And a lot of people won't do it. It's just like long-term care insurance. I've had people file claims. It doesn't get approved till after the person passed away. So, yes, ma'am. Yes. You can, but if you want to supplement, you can go to Medicare A and B. What you do is you enroll in a prescription drug plan, a separate standalone plan. Medicare will cancel your Medicare Advantage plan, but then to get a supplement, you will be subject to underwriting. They really do, it's not like, oh, I have a blood pressure pill, they're not going to accept you. That's not true, okay? But there are certain situations and conditions that they may not want to take you. We are lucky again here in Illinois, we do have a guaranteed issue company that if someone can't pass underwriting, they can go to Blue Cross and get a guaranteed issue supplement. Might be a little bit more expensive, yeah, but
not really.
no, it's not too much more. Yeah. Yes, sir. Yeah. So there's a couple reasons why that might be. One is you might be in a different stage, Part D, deductible period, initial coverage period, and donut hole. Or it's a higher tier drug or that's a tier 3 or above that has a co-insurance. If you pay a co-insurance, it's like 18% or 24% of the retail price. That retail price can change all year long. So if it's a percentage of that retail price, then your co-insurance is going to change. A set copay with a plan doesn't change, like 46%, $46 or $2, but it depends on the tier of the drug and the plan you're on. I can't tell you why without looking at the plan. Always check your drug coverage every year. Yes, sir. Thank you. This is a testament to the state of Illinois and the SHIP program, because I am trained by them, and we have conference calls every other month and a conference every year, and they keep us up to date with all the legislative and federal changes. But I've also been doing this 19 years. I'm old. I'm old. I'm a baby boomer. I'm old.
But there is also something that in a newer situation where they don't have to run for all of their activities
Yeah. Yeah, yeah, yeah. We've got some good stuff here, believe it or not. Yes, ma'am. Yes, yes. Are you doing you want a second opinion? Yeah, there's no, with regular Medicare, you can go, you can get another opinion. Just don't do it on the same day. If you do the same procedure on the same day, Medicare will deny one of them. My dad had that where he had a procedure in a doctor's office, and then he ended up in the emergency room, and the doctor's office procedure got rejected. They had to file, the doctor's office had to file the appeal, and it was denied. My dad did not have to pay for it, but it was the same procedure in both locations. So you can go to a second doctor and get an opinion. Don't do cataract surgery with both of them in the same day. Don't have them do one eye and then go to the other guy in the same day and do the other.
All right.
Okay.
Thank you all so much.
Thank you.
So Sue is with Advocate, Good Shepherd.
Yes.
And they're at booth 111.
Yes.
So if you have more questions, please see Sue at booth 111. Please fill out your evaluations for today because we want to know if you want her back next year. And if not, well, she'll cry.
Tough.
It'll be bad. But thank you.
I will cry.
Thank you. This is
Okay.